going on, everybody? I'm Emmanuel.
And I'm Ashley.
And together we are thriving with A&E. Yeah? So tell me, what we got going on today?
Alright, so we had a viewer, I guess, reach out to us and wanted to know about low back and SI joint pain. So he's been having right SI joint pain.
Okay.
So, Dr. Emmanuel, can you talk about some causes that can affect
SI joint pain? Certainly. So when we talk about the SI joint pain, we're actually talking about this joint right in here, and it's the ilium of the pelvis and the sacrum. That's where they connect. That's why it's called the SI joint.
So sacroiliac joint.
Exactly.
Okay.
Exactly. Now, what goes on sometimes is, depending on how your posture is, that can contribute to pain being aroused, right?
Okay.
So if you're sitting down and you like to cross your legs, right, that can kind of tilt the ilium of the pelvis. It can tilt that pelvis back, right, and put pressure on that joint and start to cause pain, right? Another thing that can cause pain in that area is what you talked about not too long ago. You talked about men sitting on their wallets.
Yeah. So I've noticed, like, in clinic, a lot of these men have these massive wallets.
Yeah, a lot of the men like to carry every single card they've received since the 70s in their wallets.
Right. So it's crazy. So for the ones that I've seen, they'll sit on that side with the wallet, and it just affects everything, right? So you get pain in your low back region, and sometimes, you know, being altered with your posture seated, you can get pain in your shoulder regions, and just everything is connected, right? So pain down here also affects pain up here.
Yeah.
So, you know, those guys with the really big wallets, it's like, you know, either take out your wallet when seated, or just carry a thinner wallet, because you'll start to develop some piriformis syndrome issues within that region. It's just a nerve that's within that region of the SI joint and buttocks area, and so you can have like a pinched nerve within that area too.
Another thing that can contribute to SI joint pain is sometimes if you're running or you're walking and you miscalculate your step, you put too much pressure on that foot because you miscalculated your step, all of a sudden that can kind of push this pelvic bone, push it back a little bit, put pressure on the SI joint, and that can cause pain too, right? Another thing that can cause pain in that SI joint area, if you have an anatomic short leg, which I have, right?
A very short leg. He's got a very short right leg.
Yep, my right leg is a lot shorter than my left leg. That causes a lot of my stance to kind of be, if I'm not aware of myself and I allow my stance to kind of be tilted a little bit, my hips, that puts pressure on my hips, puts pressure on my SI joint, and a lot of times I start to feel pain in my low back and in that SI area, especially on that right side, right? So all those things can contribute to SI joint pain. What we're gonna do is we're gonna take a moment to show you a couple exercises, right, that we can do, that you can perform on your own time to help you get relief if it is SI joint pain that's kind of causing you the pain. If you do any of these exercises and at any time it aggravates the pain, then you should stop.
Immediately. Stop immediately. And if you were in our office, we would do a full evaluation for this condition or the pain, or try to map out where it's coming from.
Yep.
So.
Exactly.
Alright, so I'm going to be his patient. Okay. So, Dr. Emmanuel, you said you had a few stretches for me to do?
Yep, so once again, these stretches are to help bring relief, right? So if you do these stretches or if you do these exercises and you don't feel relief and it aggravates the pain, stop right there, don't continue, okay? So the first thing we're gonna do, I actually want you to stand up.
Okay.
And you are gonna place your foot on the side of the SI area that hurts. So let's say if it was your left SI, you would place your left foot on the table. I want you to lean towards your knee. Exactly.
Like whole body or just?
Whole body towards your knee. Hold it there for 5 seconds. Yep. Relax and then stop. Do it again. Relax and then stop. So what we're doing is we're trying to bring some mobility in that SI joint, right? Because it's locked. We want to bring some mobility in that joint by Bring yourself forward, hold it there for 5 seconds, and then you stop. Another thing that you can do, if you have a bed at home, which I hope you do, I'm sure you do, you're gonna lay on your bed, the side that's bothering you, you're gonna bring your knee off the table, just like that. So I want you to lay on your back.
Okay.
Yep. And if it was your left side area that was bothering you, your left side off the table, you're gonna bring your knee off the table, just lay it off. This knee's relaxed. Good. Exactly. And that pressure would help you get relief, right? Now, if you do this and it brings you relief, and I'll continue doing this, do this for about 10 seconds, relax, and do it again. And you're gonna do these exercises this twice every 2 hours, right?
Okay.
Now I'm gonna help you up. Another thing you can do if you're at home, this is more like isometric stretching that a lot of athletes do. So another exercise you can do if you're at home, this is more like isometric stretching that a lot of athletes do. You're just gonna place the palm of your hand on your knee, and you're gonna raise that knee against the pressure of your hand.
Ooh.
Do that for about 5 seconds, relax, and do it again.
I feel that.
You feel it right there?
Yeah.
Exactly. Had a patient that did this also, right? When she was doing this, she was amazed because she was also impressed with the fact that she got relief in that exact moment. Right? Do that again? Exactly. Exactly. Now, I think you were talking about a stretch that people can do if they feel like their piriformis is a little tight.
Yeah, so a piriformis stretch would be to take your heel, like cross your legs almost, but then let your knee come down to relax, and then lightly push. Press. And that also relaxes your piriformis muscle.
Now, if you want to get another stretch, you can lean forward against your knee, and you'll feel that piriformis stretching.
Ooh, that's
very
a good
much
one.
so. Exactly.
Yeah.
Once again, these are exercises that you can do at home to get relief, right? If you came into our office, what we would do is we would do an entire exam, right? To kind of exclude and rule out things before we would be able to pinpoint exactly what it is causing you the pain.
Thank you for stopping by.